Hello everyone, this is Paul from Ortho Eval, and I have with me my friend Dave here, who is going to help with a demonstration on a C7 nerve root impingement. Dave is 49 years old, reports to me that about a week and a half ago started to develop some pain in the shoulder, some paresthesia down into the thumb, index finger, some of the middle finger, and it's been kind of agitating him, especially if he reaches a lot, and he notices that when he changes his neck position, he seems to do a little bit better. So with that in mind, he's had no mechanism of injury to cause this. He's not been hit in the head or neck or anything like that, not lifting on anything unusual, correct?
Correct.
And it's just kind of on and off and really not getting better. So he asked me to take a quick look at him. So what I'm going to do, because of the amount of time that we have today, is I'm going to do a really quick cervical spine clearing, and I'll talk you through this so we can show you how we isolate where this problem is coming from. Okay, so he's having some paresthesias, he says, down into the thumb and index finger, some into the middle finger, and occasionally some scapular discomfort on the left side also. So the first thing I do is I have this pattern. I always do reflex testing first. So I'm going to start with C7, and I don't know if you can see that, but the triceps did contract. C5, thumb on the bicep. You can't see it probably on the video, but he is getting contraction. And C6, and I'm feeling the contraction come right down here through my thumb. C7 on the left side. I get no contraction at all in the tricep. Biceps, I get the contraction same as the other side. C6, I get a nice little contraction just like I did on the other side. So it's not only about seeing movement there, but it's feeling the movement and watching the muscle to see if it does contract. So triceps are decreased on the reflexes. Can we spread those fingers apart? So we're going to do T1, hold here, don't let me squeeze, don't let me squeeze, don't let me squeeze. I'm not seeing any weakness here. Make some nice circles. C8, hold, hold, no weakness there compared to the other side. We're going to go up the line, so we're going to go to C7. So triceps, hold right here, don't let me push, don't let me push, don't let me push. I'm pushing really hard. C7 on this side, hold, hold, hold. Now he's working hard, huh? Okay, do it again, hold tight. Hold tight, and he can't hold that. And it even hurts a little bit because the muscles aren't recruiting very well and he's using less of that to contract. So we're going to work up to the next level, C6. Hands out like this, don't let me push down, hold tight, good. Hold tight, good, perfect. C5, biceps, hold, and hold, great. I also like to do supination for C5, so don't let me turn your wrists in, hold tight, no weakness there. And then we're going to go to sensation testing next. So we're going to have the hands up like this. So you notice he had loss of reflex C7 and he also had loss of strength C7. Now let's check the sensation. Does this feel the same or different?
Same.
C5, C6, same or different?
Same. No.
Less on this side? Okay, so a little less on the C6-ish area and there's a little carryover. How about here? Same or different?
Same.
Okay. Same meaning the same as before?
Yes.
It's also less here.
It's a half.
Right.
This side feels great. This
Yep.
side, I don't know.
Okay. Right. So C7. It's important that you ask if it's the same or different from one side to the other, not same as the last time you tested him in the previous dermatome. Okay. Is this the same or different?
Same.
C8 and T1.
Same.
And it's the same. Okay. So we have some loss of sensation. C6, C7, loss of triceps, C7, and loss of reflex, C7. Now we're going to do a cervical spine compression test, which I don't put a lot of weight into, but I put a little 5-pound pressure here. I have him look straight ahead. Does that increase your pain any?
Okay, just a little tight back.
So he feels a little tightness in the upper trap. Now we're going to do a Spurling's test. So we're going to rotate him, laterally flex him, and extend him to the same side.
Oh, yeah.
And he doesn't like that at all, okay? And his pain goes down into the shoulder, and he occasionally has pain tingling into the fingers. All right, so that is a positive Spurling's test. I'm going to do it on the other side. Not so bad there.
No.
Doesn't feel the same at all.
No.
Okay. The other thing that we did with Dave is we put him on the table and we did a Marquis maneuver with him. So we laid him flat on the table on his back. He had a little discomfort in the neck. We tractioned his neck, opened it up to the opposite side, and we retested his strength, and he was able to hold 5/5 muscle strength while doing that. So that really isolates that this is a C7 nerve root compression problem. Right now, I think he needs to get on something that decreases inflammation significantly, and we're also going to place him into a home traction unit that he'll use about 3 to 4 times a day to help decompress that area, since he had such good relief when I was giving him manual traction. We'll keep an eye on him. We're going to keep reassessing his strength, because that's really the big red flag on if we should expedite, if he should go to surgery or not, or see, I shouldn't say surgery, but see a neurosurgical specialist. We'll go from there. Not everybody who has these signs of a herniated disc or nerve root compression have to have surgery. A lot of these people will get better in a reasonable amount of time, like 3 to 4 weeks. So we keep a close eye on him. If he becomes weaker and starts to develop more pain, then I think we need to look at getting an MRI and diagnostic imaging. But I think conservatively, we can certainly give this a go, and I think he will do well because he's a healthy guy. He doesn't smoke, he doesn't drink, he exercises and runs all the time, he spins all the time, and he's a weightlifter. And so because he's healthy, we'll probably do well conservatively. So please leave any comments or questions you have below in the comment section of the video. Make sure you like our video and subscribe if you haven't subscribed to us, and please keep watching videos, and I hope you enjoy the content. And Dave, thank you very much for being my subject today. Take care.